Hello and welcome to Medical Dialogues. I am Dr. Bhumika Makhuri. Let's look at today's top medical news. COVID-19 vaccination reduces dialysis and mortality risk in acute kidney injury patients study. Vaccinated patients hospitalized with COVID-19 who developed acute kidney injury had better outcomes than unvaccinated patients with the same condition, according to new research published in the journal Kidney Medicine. The study showed that patients with prior vaccination were less likely to stay on dialysis after discharge and more likely to survive than unvaccinated patients. The findings suggest that COVID vaccination can reduce long-term kidney function decline and mortality risk. The researchers analyzed about 3,500 patients hospitalized with COVID between 1st March 2020 and 30th March 2022. Of those patients, 972 developed acute kidney injury, with 42.3% unvaccinated and 48% having received at least 2 doses of the Pfizer or Moderna mRNA vaccines or 1 dose of Johnson & Johnson's vaccine. How early can cancer be detected before symptoms appear? Genetic material shed by tumors can be detected in the bloodstream 3 years prior to cancer diagnosis, according to a study published in Cancer Discovery. To determine how early cancers could be detected prior to clinical signs or symptoms, researchers assessed plasma samples that were collected for the atherosclerosis risk in communities (ARIC) study. They used highly accurate and sensitive sequencing techniques to analyze blood samples from 26 participants in the ARIC study who were diagnosed with cancer within 6 months after sample collection and 26 from similar participants who were not diagnosed with cancer. Sleeping 2 extra hours on weekends may calm teen anxiety. A new study presented at the Sleep 2025 annual meeting and published in journal Sleep found that teens who get moderate but not excessive catch-up sleep on weekends have fewer symptoms of anxiety. Results show that teens who got up to 2 more hours of sleep on weekends than on weekdays exhibited fewer anxiety symptoms compared with those who did not sleep longer on weekends. However, longer durations of catch-up sleep on weekends were associated with slightly more internalizing symptoms. The American Academy of Sleep Medicine recommends that teenagers 13 to 18 years of age should sleep 8 to 10 hours on a regular basis to promote optimal health. However, CDC data show that only 23% of high school students get sufficient sleep on an average school night. That's all for today. Stay tuned to Medical Dialogues for latest update.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.